Okay, so today we're diving deep into, well, how to stay healthy, especially as guys hit that 40 mark. We've got two main sources we've been going through. One is it's called Men's Health Over 40, Key Concerns and Prevention.
Uh-huh.
And the other one, it's got a pretty similar title, but it lays out like the top 10 health things to watch out for, once you hit that age.
Right. Yeah,
And that's really,
exactly. So it's like, you're busy, you don't have time to read all these long reports. So we're going to try to break it down for you. Like, what are the most important things to know?
yeah, what really jumps out from both of these reports actually is how much your lifestyle after 40, how much that really impacts your health. It's like kind of like a turning point, right? Where
Yeah.
things can go either way.
Yeah, definitely.
Okay, so let's start with something that both reports say is a huge deal, and that's heart disease.
Yeah, absolutely. I mean, it's one of the top causes of death for men over 40. And what these reports really emphasize is the risk factors, right? Like
Sure.
high blood pressure, high cholesterol, diabetes, smoking, and not getting enough exercise, that sedentary lifestyle. And, we've all heard about these things before, but it's like once you hit 40, they become so much more important.
Yeah, it's not just like a vague warning anymore. So the reports, what do they recommend? Like regular checkups, obviously. Right?
Exactly. Yeah. Regular checkups, keeping an eye on your blood pressure, getting your cholesterol checked. And, really the big one is maintaining that healthy lifestyle through diet and exercise.
And they really emphasize that. Okay, so moving on, both reports also talk a lot about prostate health. What did you find interesting there?
Yeah. Well, it looks like men over 40 have a higher chance of prostate problems, right? Like benign prostatic hyperplasia, BPH.
Okay, and remind me what that is again.
So BPH, that's when the prostate gets bigger, but it's not cancer.
Oh, yeah.
But there's also obviously the risk of prostate cancer.
Right.
So the sources really push for regular screenings, things like PSA tests, because early detection for prostate cancer, is really key for successful treatment.
Makes sense. They also say it's important to talk to your doctor, right, to figure out your own personal risk factors.
Exactly, yeah, because
Yeah.
everyone's different. Okay, so let's switch gears a bit to type 2 diabetes.
Yeah, something else that's more likely after 40, right?
Definitely, and especially if you have a family history of diabetes or if you don't eat great or don't exercise much.
And we know diabetes can also, increase your risk of heart problems. It all ties together, doesn't it?
Yeah, exactly. It all connects. And, the advice for preventing or managing type 2 diabetes, it's not surprising. It's all about checking your blood sugar regularly, eating healthy, keeping a good weight, and staying active.
So it's that healthy lifestyle again. Okay, now let's talk about something that's maybe less talked about,
Mm.
but equally important, mental health.
Yeah, I'm glad both reports touched on this. They focused on depression and anxiety. And what's interesting is that they say these issues can get worse with age, especially if you're going through big life changes.
Yeah, like what kind of changes?
Well, things like changing careers or your kids moving out or even just dealing with other health problems, all that can really impact you mentally.
Makes sense. And what are some signs to look out for? Like if you or someone you know might be struggling.
So they mentioned things like losing interest in stuff you used to enjoy or having trouble sleeping or changes in your appetite. And, if you notice any of those things, they really encourage people to get professional help like therapy or counseling.
It's important to remember that that's a sign of strength, not weakness. All right, let's
Yeah.
move on to another topic that, well, it's definitely something that guys think about as they get older. Sexual health.
Right, yeah, for sure. So both sources talk about common concerns like erectile dysfunction or ED, and also lower testosterone levels, which are more common after 40.
Uh-huh. And what do they suggest?
Well, they really encourage men to talk to their doctor if they notice any changes in their sexual function.
Yeah, don't be afraid to bring it up.
Absolutely. It's important to get a proper diagnosis.
No.
And they also mention that, keeping a healthy weight and managing stress can be beneficial for sexual health, too.
So it all ties back to those healthy habits again.
Yep.
Okay, now something that can be really serious, high blood pressure.
Yeah. The reports make it clear that high blood pressure or hypertension is a big deal. It can lead to all sorts of problems like heart disease, stroke, even kidney damage.
Wow.
And they say it's crucial to get your blood pressure checked regularly because, a lot of times you don't even feel it.
That's scary.
It is. So what can you do? Well, they recommend a low-sodium diet, regular exercise, and of course, quitting smoking.
Okay, so another thing that can change as we get older our eyesight.
Yeah, that's right. The sources explain that, as you get into your 40s and beyond, you might start having trouble seeing things up close. That's called presbyopia.
Oh, yeah.
And a lot of people end up needing reading glasses. They also mention a higher risk for cataracts and macular degeneration, which are serious eye conditions.
So regular eye exams are important, even if you think your vision's okay.
Definitely. It's about catching things early. Okay, now let's talk about something else that can affect your quality of life as you age. And that's, your joints and bones.
Right. Things start to ache a bit more, right?
Exactly. And the reports say that, especially if you're less active as you get older, you're more prone to problems like arthritis, osteoporosis, and just general joint pain.
Oof. What can you do about that?
Well, they recommend getting enough calcium and vitamin D, staying active, and doing some weight-bearing exercises to keep your bones strong.
So staying strong is key. Now, a topic that's always a bit concerning, especially as we get older, cancer.
Yeah, both reports emphasize that cancer risk goes up as you age. They specifically mention colorectal cancer, lung cancer, and skin cancer.
Those are some big ones.
Yeah, and they really stress the importance of getting screened regularly. That means things like colonoscopies, skin checks, and lung cancer screenings if you're a smoker.
Right. And maintaining a healthy lifestyle helps too, right?
Absolutely, yeah. Prevention is always best. Okay, so now, something that can really affect your sleep and overall health. Sleep apnea.
Yeah, that's where you stop breathing for a bit while you're sleeping, right?
Right, exactly. And the reports say it's actually pretty common in men over 40. And the interesting thing is that they link sleep apnea to other health issues like fatigue, high blood pressure, and even a higher risk of heart problems.
So it's not just about being tired. It can be really serious.
Yeah, it's definitely something to pay attention to. And they recommend that if you snore loudly, or if you have pauses in your breathing during sleep, or if you're just really tired all the time, talk to your doctor about getting a sleep study.
Good advice. Okay, last but not least, let's talk about weight management, something that many people, struggle with as they get older.
Right, and both sources acknowledge that your metabolism often slows down after 40, which can make it harder to maintain a healthy weight.
Yeah, it's not fair.
No, it's not. But the good news is the advice is pretty straightforward, and it aligns with everything else we've talked about. It's about eating a balanced diet, getting enough exercise, and avoiding those fad diets that never really work in the long run.
So it all comes back to those healthy habits. It's amazing how connected everything is.
Yeah, it really is. I think the main takeaway from all of this is that, being proactive about your health is absolutely essential for men over 40.
Absolutely.
It's about knowing the risks, making those lifestyle changes, and getting those regular checkups. It's really in your hands to stay healthy and prevent serious problems down the road.
It makes you think, though. These sources give us a good overview of common health concerns. But what about all those individual things that can also impact our health? I mean, things like stress levels or access to good health care or even how strong your social connections are.
Right.
Those things aren't always mentioned in these general health reports, but they can make a big difference. It really highlights how everyone's different and the importance of having those conversations with your own doctor to figure out what's best for you.
Couldn't agree more. It's about that personal touch, for sure.
Yeah. Well, on that note, that's our deep dive into men's health after 40.
Stay healthy out there, everyone.
Until next time.